Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Jason Bousset, whose work may guide best treatment choices for a better recovery.
Chiropractors often face a challenge of trying to understand which of my patients are likely to do better or worse than another, and which of my patients require more care or more attention. And so if there was some way to help chiropractors triage more effectively, who are my high-risk patients? And for what reason are they high risk? And can I tailor my approach to try to help that person in a different way than someone who's at very low risk of prolonged recovery?
One of the things Dr. Bousset is looking at is an often overlooked factor in patient recovery: attitude and belief. For this study, a questionnaire was administered to a group of patients with standardized care who were all to receive knee surgery.
We had an instrument that we designed to capture patients' beliefs and attitudes towards their recovery at a very early point in their recovery. We asked patients' beliefs and attitudes about a month after they had surgery, and then we followed them forward for a year. And what we found is that there were 27 items in our survey that separated out the group that had recovered and gone back to work versus the group that had not recovered and was unable to go back to work. And all of these variables were potentially modifiable.
Theoretically, we can take this questionnaire and administer it to the patient. By looking at the items that the patient may have endorsed, we can then tailor the intervention to try and modify those particular variables that seem to be standing in the way of their recovery.
You need that human element. You can't just have a computer saying, well, you're in this bucket, too bad, here's why. You need to have a clinician that's going to interpret and then incorporate that into the treatment plan in a skillful way.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.